let's explore autistic history and the Autism Wars. This is part 90 of the series. So I've been sharing updates about Cure Autism now that they published about the first 4 years of their organization. And the very last piece of that I'm going to share with you, which is legislation. So they started off by saying we'd like to take this opportunity to share with you some of the highlights of CAN's first 4 years of operation. Many of these are milestones that would have been unheard of just a few short years ago. All of them are thanks to the unending support and dedication of thousands of families, friends, scientists, researchers, corporations, and foundations across the country and internationally. People who believe, that belief system is going strong. So people who believe, as we do, that there is hope for a better future for people with autism. And then here's where we're headed this whole time. The next section is called political action. Let's take a peek at that. It says Cure Autism Now helped to introduce new and improved federal autism legislation that mandates over $40 million or $40 million new dollars a year for biological research in autism, a national family and physician education and awareness program, and a major new effort to study prevalence, meaning how many of us actually exist. So it says here, this new and improved federal autism legislation that was presented or introduced, let's see, it was endorsed by Cure Autism Now, or CAN, the Autism Society of America, or ASA, and the National Alliance for Autism Research, or NAAR, and it combines and unites all past efforts and is the single most important piece of legislation ever proposed for autism. Now, just take a look at what they talk about, the joining of CAN, ASA, and NAAR together to work towards this legislation, so you can see how that divide in the autism community is showing up in the public way at this point. So you have Cure Autism Now, ASA, NAAR, and they're uniting, and they're finding that if they team up together, they're more powerful and they can be heard over the other autism organizations. And for sure, they're all extinguishing the voice of autistic people in this already. So let's talk about this next bit. So it says here on May 9th, 2000, this autism legislation within the Children's Health Bill passed overwhelmingly by a vote of 419 to 2. We stand a very good chance of getting autism research legislation passed in the Senate. And then it talks about how to go find out more to make a critical difference and to go to their action alert page or to call their specific number here. So they're bringing in the parents, you know. The more parents you have, the more political power you have in getting something done, I suppose. But now I'm going to share with you an article that ran in 1998 that speaks to this a bit more. So this article ran October 18th, 1998. It was titled Mother Tries to Raise Awareness of Autism, and it ran in the Contra Costa Times, which I believe is here in California. So it says, Danville woman whose son is afflicted with the disorder works for treatments, early detection, prevention, and a cure. When Elizabeth Emkin's first child, Alex, was born 6 years ago, she held him in her arms, looked into his face, and thought, how lucky am I to have this perfect little boy. Like almost every mother, Emkin had concerns of having a healthy baby, and as far as she knew, she had one, until Alex grew incommunicative and disengaged from the rest of the world. By 18 months, the Emkins knew something was not right with Alex because he wouldn't talk. By age 2, they knew something was definitely wrong when he would not interact with other children. But it wasn't until the age 4 that doctors diagnosed Alex with autism. Autism is a neurological disorder that, this is their language, robs children of communication skills, cognition, and social development, affecting their ability to relate to the world around them, said Emkin, who has become an expert on the disease since her son's diagnosis. Okay, so another parent now turned expert. Leading the way with science, yay. All right, that's the insidious thing about autism. You don't know what it is and what to do until it's almost too late, said Emkin, becoming teary-eyed. We lost 2 years trying to get his diagnosis. That's what's really hard for me. I don't want another parent to feel that. Going back into belief systems here. It says here, this Danville resident firmly believes autism is treatable. Quote, there's a great deal you can do, but the younger you start, the better chances of recovery, she said. That hope motivates Emkin to fight for more funding and research for autism. She is a member, surprise, surprise, of Cure Autism Now, a foundation involving parents, clinicians, and scientists dedicated to finding effective biological treatments, early detection, prevention, and a cure for autism. And just another reminder, a note, when the autism community is included, the autistic community is excluded, and we see that here one more time, yet again. All right, so it states here, she heads the organization's fundraising for the Bay Area chapter in his National Political Action Committee. Emkin left a high-paying management position with IBM to devote almost all her time to her son and her cause. Her husband focuses on keeping the family afloat financially despite the high costs of treatment for their son. Alex, now 6, attends kindergarten with an adult who helps guide him through the day. I think we call that here a shadow. Like when the kids have a shadow in school, a person that helps them throughout the day. At present, Emkin is busy helping to pass legislation that would develop a public awareness campaign on autism and a lot more funds for treatment and research. The bill, called the Advancement in Pediatric Autism Research Act, has gained support by more than 24 congressional representatives, including Democratic Senators Barbara Boxer and Dianne Feinstein, and Rep. Ellen Tosher and from Sahara Valley, sorry about the pronunciations. Once thought rare, autism is now known to be the 3rd most common developmental disability, more prevalent than multiple sclerosis, Down syndrome, cystic fibrosis, and childhood cancer. It affects 1 in 500 children born every year and strikes. It strikes, y'all. Between 1 and 2 years of age. Autism affects about 400,000 individuals in the United States and costs more than $13 billion annually to treat, according to Cure Autism Now. And out of those 400,000 individuals with the autisms, they couldn't bring one to speak from an autistic point of view for this legislation. Definitely not. We wouldn't conform to their agenda, but I will share the rest of this article on the upcoming video. Thank you for exploring a bit more autistic history with me. We will jump back into 98 and 99 and learn more about this legislation push.